My name is Mike Koch. I am the chair and a urologist at IU Health. I started practice in 1986 and I moved my practice to IU Health in 1998. I started out my education thinking I wanted to be an engineer. I went to college and started down that career path, and towards the end of my college experience I started feeling like engineering was very dry, and I was seeking more of a experience with people. So late in college I decided I wanted to go to med school instead, and that was partly based on some work I'd done in biomedical engineering. So I took a year off after college, did what I needed to do to get into medical school. I was pretty young at that point, and got into medical school, fortunately, and liked basically everything in medicine, but I was a little bit more drawn to surgery. And then while I was in medical school, I actually had, my father had been diagnosed with kidney cancer, and partly based upon that decided I was probably interested in urology, and chose urology as a career path. I've never regretted it. I've always found it very interesting. It's a very personal type of specialty where you talk to people about very personal issues, very intimate things sometimes. And it was that people connection that I'd always been looking for. So I think the most important thing that I try to offer patients when I see them, especially for the first visit, is I try to listen well. I think that's the hallmark of the best doctors, is someone that really can pay attention to what the patient's saying, maybe read between the lines as well, and understand how their conditions are affecting their life. I focus my practice on bladder cancer and prostate cancer, and those things affect very intimate things for people, and you really have to pay attention and empathize with the person so that you can understand and explain to them how the different treatment alternatives can affect them in a very personal way. I have both an administrative and a patient care role within the department. As chair of the department, I have lots of administrative responsibilities. What I enjoy most, though, is the patient care. Urology is a great specialty. I mean, patients are usually helped quite a bit, and we improve their quality of life most of the time. And they're very thankful and appreciative for that. So on a daily basis, I get people that make me feel like I've contributed things in a meaningful way to their lives. Well, there's nothing unusual about me in terms of what I do in my free time. I'm a bad golfer. I aspire to be a great golfer. It'll probably never happen. I enjoy being with my family, and I now have 5 grandkids, and make the most of the holidays and other time with them.